Mervyn, thank you so much for joining me and taking the time to speak to us. So the first question is, under the NHS dentistry reform, COVID patients are visiting surgeries less and less frequently and are less able, in some cases, to visit the surgery. What changes are you seeing when those patients then do come through to you?
Well, what's happening, because of the difficulties in the NHS, both with patients' apprehension to attend and dentists not seeing as many patients as they saw before, and that's what the biggest problem is. There's huge difficulties patients getting appointments, as you can see from the press and even from the local politicians. And so by the time they come to us, things are really complicated, whereas there was just simple decay where you could have got away with a filling. Now you're dealing with a decay that's got through to the nerve. You've got to start dealing with root canal treatments, and that makes it really expensive. So then the patient just wants the tooth out, and that's on the one side of things, from the carie side of things. And then you've got all the hassles from the gum side of things, because whereas before they were seeing a dentist regularly, they were getting to see a hygienist even, and they were monitored and maintained. And now the maintenance has absolutely gone to pot. So we're getting patients in who haven't seen a dentist or a hygienist for 3 years, and the hygienist we were talking yesterday, it's pretty gross. The gums are inflamed, they're bleeding. If left, teeth start to become loose. It's just a whole cycle of destruction, really.
Yeah, of course. And then of course, some patients aren't aware, might not necessarily be aware, so they come in and also might ask for certain treatments, and are you finding that you can't necessarily offer certain treatments to them because their oral health is at a certain level?
100%, and that's the problem, because now whatever they need is expensive and complex, so they have to pay in time, they have to pay in cost, and they're not used to that. The majority of people who've been getting dentistry on the NHS have been always paying a supplement, but nothing to what they've got to pay if they get into the private sector.
Absolutely. So because the patients you're seeing now, they're coming with different needs, different requirements, what kind of changes are you making at your practice to try and accommodate for that?
Well, the first thing you try and do is try and get them on a self-maintenance type of program to see what they can do themselves. So you look at their home care, so you're looking at their cleaning, their flossing, and that sort of thing that they can do for themselves. And then you look for some things that can aid, and this is where I talk about Ultradex, because Ultradex is a terrific product. It's a toothpaste and an oral rinse, and it's brilliant for treating gum inflammation, because it really does help lower the level of inflammation. It helps to lower the level of bleeding as well. So, and as an additive, it's great for treating patients with bad breath, because often gum disease causes bad breath. And if you can get that reduced, you'll get rid of the mouth odor. So those products definitely help. Before we even do anything, we put them on a regime of rinsing with the oral rinse and using the toothpaste. And once they've been doing that for a couple of weeks and they come in, things certainly look a little bit better.
Absolutely. And then once you've treated them, once you've gone through the process, what would you recommend to other dental care professionals that they do? What should they recommend to patients so that the patients can try and maintain their oral health a little better in between visits?
It depends on the home care. They need to go back to that old-fashioned way of doing things. Brush your teeth in the morning when you get up, and brush your teeth at night before you go to bed for at least 2 minutes. If you can use an electric toothbrush, it's even better, because then if you're not that dexterous, your teeth you'll still be doing a better job. And if they can get themselves on a regime of using something like Ultradex, the rinse in the morning, and then using the toothpaste in the morning and the evening, that itself is just a wonderful regime to go on. I personally have not used another toothpaste since I introduced it to the UK for about 16 or 17 years. In fact, the only time I use another toothpaste is when I'm on a flight. When you get those free little tubes on the flight, you can just go and brush your teeth quickly. It's a brilliant toothpaste. It really is.
Okay, excellent. Mervyn, thank you for your time. Really appreciate your time. And thank you for taking time to speak to us.